Medical knowledge changes quickly, very quickly. In 7 years' time, half of knowledge is obsolete, so it's impossible for a physician to practice based only on what he or she learned in medical school. Unfortunately, in France, continuing education is still seeking its way. First, it was up to the individual, then it became an ethical requirement, then a legal obligation in 1996. A physician must complete around 4 days of required training per year. But since no penalties were ever imposed, the obligation remained a theory. It's quite different in the United States, where a physician who doesn't demonstrate that he's completed a certain number of hours of training may have his license revoked. In the absence of a clearly defined requirement, the state of continuing education of French physicians remains difficult to evaluate. The French Inspection of Social Affairs knows this well. In 2008, their report highlighted the lack of information about continuing medical education. Multiple actors and overlapping responsibility make the current organization too complex to manage and to finance. For private practice physicians, there are two funds, depending on whether the CME falls within a conventional agreement or not. Why is there a blockage regarding CME? Let's follow the money. Who is financing CME? Someone is. Physicians are financing some through their membership fees paid to CME associations. Public hospitals are obligated to finance continuing education for their personnel. Social Security deducts charges from CME from physician revenue. And last but not least, the pharmaceutical industry is still and has always been present, despite all the ethical issues that this raises. This all represents millions of euros. And everyone, trade unions, associations, medical journals, and others, want their share. The government seems to be postponing a tough decision it simply doesn't want to make. The solution is now supposed to come from continuing professional development, written CPD in Public Health Code. With CPD, we no longer have to distinguish between training and evaluation. Financing would come from only one fund. Is this just a new label on an old concept? In order to tell, CPD first has to exist. But we've been waiting for tomorrow for 15 years.